Hey, what's up, YouTube? What's going on? Today I want to address a question that I often get asked, and that is, will my life be normal after a disc herniation? Now, there's a few things to keep in mind when answering this question. Number one is that not everyone that has a disc herniation has symptoms or pain. There's a lot of people out there that have disc herniations, but they're asymptomatic. So for this video, we're referring to people that have a disc herniation and may be symptomatic. Now, using my own experience, there's a few things to look at. So back when I was younger, when I was 20 years old and I had hurt my back, I didn't know how to lift properly. I didn't know that things like sit-ups, repeated cycles of sit-ups would cause a disc herniation. I didn't know that lifting with bad techniques, say on a deadlift or squat, could cause a disc herniation. I didn't know that prolonged sitting and then going to do activities afterwards can be bad for the back. I didn't know early morning spine bending puts yourself at a greater risk for a disc herniation. So there's a lot of factors that I just did not know about at that time. And for me to say that is normal is hard to justify. And a lot of people that ask me this question will say, is their life going to be normal again? Now we have to define what normal is going to be. Is normal sitting for 8 hours? Is it doing thousands of sit-ups? Is it lifting like you did? That's not normal for the low back, and that's just not healthy. And to kind of explain it in a little bit more detail, Dr. Stuart McGill uses the concept of spine hygiene. Now think of hygiene, if you don't have practiced good hygiene, you're going to smell, you're going to stink. Now, the same thing can be applied to the spine. If you don't practice good movement patterns, you don't move well, if you're really stiff and maybe your hips, if you're not lifting properly, it's just bad hygiene for the spine, and you're putting yourself at a greater risk for injury. So we have to keep that in mind, and there's going to be changes after you make a recovery, you get to that point. You're going to have to change things. There's no doubt about that, because what you were doing before is not normal. There's a reason why you got injured in the first place, and that's because you just weren't practicing good movement patterns or whatever it is, and you've created this injury. So things are going to have to change, there's no doubt about that. And your exercise routine, training routine is going to have to change. You have to understand how disc herniations develop. Doing sit-ups for someone with a disc herniation, it's not going to be something that you want to do. Prolonged sitting, that's going to be hard to kind of work around. But you have to keep in mind that there's different strategies that we can use to manage this, especially when we get to that kind of pain-free point. We just need to be smart in how we approach things when we get to that point. So using just myself again, I didn't think that I was going to be able to get back to deadlifting or playing hockey. I've been able to get back to both of those and feeling better than ever. But I've had to change a lot of things to allow me to do those things pain-free. Whether that's changing my exercise routine, understanding how to deadlift properly, or it's changing my posture when I'm sitting on the bench, like when I'm playing hockey, or tying my shoes, just adjusting my position. Those are little tips that I've been able to implement to help spare my back, and spare me of any kind of relapse per se. Now, those are a lot of things that are going to have to change. Now, that's what's going to have to happen. And to say that you can have a normal life afterwards, you just have to define normal. There's definitely going to be changes. And yeah, I think a better question to ask is, can you be pain-free afterwards? Yes. You just need to go about it in a strategic and smart way when it comes to moving, your training habits, and your lifestyle overall, what you're doing. Because one wrong thing can cause a relapse and a flare-up. You do not want that to happen. So, overall, can you be normal again? Depends what you define as normal. There will be changes afterwards, and you're gonna have to make changes to your lifestyle. So that's what I'll say, but you can get back to activities that maybe you're not able to do currently. Like I said, I never thought I'd be able to get back to deadlifting or playing hockey. Both of those I got back to. So that's something that you just need to think about and change your mindset a little bit about when thinking about mechanical based back pain in the sense of a disc herniation causing symptoms for somebody. So I hope this addresses your question, and for anyone out there that is wondering this, I hope this helps this video. If you have any more questions or comments, or you want to follow up with me, feel free to leave a comment below and I'll be happy to get back to you. Okay, all the best guys, and take care.